All right, welcome everyone to the Asia Liberty Forum Online. I, along with the Atlas staff who are joining with me today, are really excited to be with you in this unique time. We're really looking forward to what is our first online regional forum and what we think will prove to be a really wonderful time together in connecting and spending some time together today. Major sponsorship for the Atlas Network Regional Liberty Forums are provided by the John Templeton Foundation, the Smith Family Foundation, the Frida Utley Foundation, the Templeton Religion Trust, Rainbow at Atlas, Thomas W. Smith Foundation, and the Sarah Scaife Foundation. We want to remind everyone to please keep your microphones muted and videos off during the main session in order to keep disturbances to a minimum. We'll get to turn the videos on a little bit later, don't worry, and we'll have some time to chat as we get into some breakout rooms. But to begin with, if you'll keep those videos off and the microphones muted, it'll just make the experience better for all. You are invited to engage with us in the chat box, which I see many of you are doing. That's fantastic. And we will be breaking into some smaller groups to have some discussions as it relates to the main speaker's comments that he'll be sharing here in a little bit. We'll also be sharing another tool and platform that you'll be able to use to continue some conversations as well about how we can crowdsource ideas and take the challenges that we're all facing and turn those into opportunities to move forward in a positive way for freedom and for the world. To kick off the forum, I'd like to invite Calixto Chikiamko to share a few remarks. He is the president of the Foundation for Economic Freedom. And Calixto and his team have been tremendous partners during this time. Obviously, they were very much looking forward to having us in the Philippines. And with everything happening with COVID, they were just tremendous partners in helping us pivot and getting ready to be online together today. And so we felt it very appropriate that he would have a few minutes just to share a few welcome thoughts and a hello from his team as our partner for this very first Asia Regional Liberty Forum. Calixto, look forward to hearing a few remarks from you.
Okay, thank you. Good morning and evening for some of you, ladies and gentlemen. Welcome to the 2020 Asia Liberty Forum. We hope you have stayed safe and healthy. We are meeting in very special circumstances. The forum, which was scheduled to be held last month in the Philippines, had to be postponed due to the travel restrictions and fear of the pandemic. We are therefore staging this conference virtually through the magic of technology, coming together from various parts of the world to discuss life and liberty in the age of COVID. Indeed, never in our wildest imagination did we imagine that American patriot Patrick Henry's cry of "Give me liberty or give me death" is today's Sophie's choice, a terrible trade-off between life and liberty. Or is it? Asia offers models not just of authoritarianism and steep price in liberty that defeating the epidemic entails, but also of vibrant democracy and continued economic freedom. I refer to South Korea and Taiwan, which both have managed to keep normal life going and have harnessed the virtues of transparency, freedom, and accountability in a democracy to manage the epidemic at the least cost to the economy and personal freedoms. We have much to learn from them. Indeed, each society is different. While the virus is the same, the institutions, the healthcare system, the culture, the trust people have in their leaders differ across countries. Even countries that are democracies, say the United States and Sweden, have vastly different approaches. Nobody can claim at this point that their approach is superior to the other. There are those who say that economic and political freedom are hindrances to defeating this epidemic. Because if you believe in the narrative that some politicians peddle, government knows best. For example, as pointed out by one of our organizers' co-founders, instead of relying on personal responsibility, our government imposed a curfew to limit people's movements, ostensibly to mitigate risk infection. The result, however, is that people tended to congest more in groceries during the short window hours and put themselves at greater risk of infection. Had the government not limited the window hours, people will responsibly spread out their visits to the groceries in an extended 12-hour period and practicing social distancing. Personal freedom, therefore, isn't incompatible with public health. Dear fellow freedom fighters, we can't shake hands, but we can share stories, experiences, and views about how economic freedom, transparency, and democratic accountability can actually help in vanquishing society's invisible enemy, the coronavirus. Thank you. May the conference be productive for you.
Calixto, thank you for some tremendous opening remarks. Very inspiring and tremendous opportunities in the face of challenges. Thank you very much. As we shift gears now, it is my pleasure to introduce our main stage speaker, Yazad Jal, who is the director at ZCS Academy at the Center for Civil Society. In his role, Yazad creates, develops, and manages all the training and education related programs of the center, including the flagship iPolicy for Young Leaders. Previously, Yazad was a fellow in economic policy and managed the technology and policy program at the Takshashila Institution in Bangalore. Before that, he worked as a management consultant in the United States with McKinsey & Company, IBM Global Business Services, and his own independent consultancy. Yazad has also been active in the nonprofit sector in India, serving as CEO of the Praja Foundation in Mumbai from 2002 to 2006. He received his MBA from Yale University and a bachelor's in economics from St. Xavier's College in Mumbai. And we look forward to his remarks in a free market or classical liberal approach to the COVID pandemic. Yazad, to you.
Thank you so much, Lyle. And thank you, Atlas Foundation, for having me. It's great to be here online to talk about not what government can do in this pandemic, but what free society, what markets and liberal society can do in the pandemic. I'm going to share a brief presentation. I think it's on, yes. So what's the problem? Let's start with what I saw sometime back on Matt Ridley's Facebook page, and I think that was a very good explanation of what the problem was. And if you look at these three concentric circles, the first is people taking COVID-19 seriously. The second is people concerned about the economic devastation that it's going to bring. And the last is people worried about the expansion of authoritarian government. And in a sense, there are very few people like us who are there right in the center, who are concerned about the pandemic, who are concerned about the economic devastation, but are also worried about the expansion of authoritarian government. And that's something that we must take into consideration and be wary of. So what should the role of markets and civil society be? I've put down some preliminary thoughts. The first is to make a vaccine. We shouldn't really expect government to make the vaccine. It's going to happen through free society. Repurpose resources to make masks, personal protective equipment. Use innovative methods to deliver medical advice. Fund research. Feed the poor. And finally, check government excess. I'll take a few minutes on each of these. So the first one is make a vaccine. And Bill Gates has already proposed to set up 7 factories to ramp up proposed vaccine development and production. According to the WHO, as on the beginning of the month, there were 2 candidate vaccines in clinical evaluation and 60 candidate vaccines in preclinical evaluation. This is all through free market, through private companies, through nonprofits. It's not being done by the government. So a vaccine will come from civil society. The next thing is till the vaccine to kind of help us stay protected. Masks, personal protective equipment for doctors. And here's where I would say, don't worry about price gouging. We keep thinking, oh my God, these huge prices for these products, the government should set price limits. But whenever government mandates a price ceiling, it'll cause a shortage. It's something that we know and something that we've seen. For example, in India, when the Supreme Court stated that only when testing kits should be given out for free, we saw a freezing of the market to some extent, till the Supreme Court had to go and restate itself and tell that no, testing kits can be sold, but only for those who are within the government insurance schemes, it should be given for free. For the rest, it can be sold at market prices. So mandating a price ceiling causes shortages. So let the market work its way. This is a picture of this gentleman who hoarded a lot of, I think, hand sanitizer and masks in the beginning, and he was shamed by the public in the United States. And I think what he was doing was a service to people. So let's not ignore that. The third thing that I would look at is innovation. Telemedicine, for one. It's not new, but this is one thing that we've seen regulations drop in many countries across the world. Earlier, there were stricter regulations that close to ban telemedicine. Today, we are seeing much more of telemedicine because doctors and patients don't want to kind of increase their risk of exposure to the virus. Another way is to remove barriers to medical workers. We have barefoot doctors. It's a term, but what these are doctors with 2 or 3 years of medical, or actually not just doctors, but they're healthcare professionals with 2-3 years of medical training who go out to villages and underserved areas where there are very few doctors or no doctors at all, and help in delivering medical services. We've got states in India that have run pilot projects for it, but these are not recognized by the Indian Medical Council. So you see a picture where there is this poor villager who is being treated by a healthcare professional who has 2 or 3 years of medical training, but may not be a full-fledged doctor. So these medical workers also provide essential services, and we must make sure that we don't, erect barriers for them. Instead, let's remove these barriers. The third is funding research. Very often when we look at funding research, we expect the government to fund research or large universities which are funded by government to fund research. But research is also funded by the free market. I mean, there are some examples. Emergent Ventures at Mercatus Center in Washington, D.C. It's got $1 million in prize money for work combating the new coronavirus from the Thiel Foundation. Top consulting firms, for example, in the free market do a lot of research, whether they be McKinsey, the Boston Consulting Group, Bain. So you see research is also happening in the free market. It's not the domain only of government to fund research. The next is feed the poor. We found that there's a large amount of people who are becoming destitute, especially in some of our countries in Asia, because there is a large lockdown and people can't go out and work, especially daily wage laborers. But who's going to feed them? Who is going to offer them the basic services and necessities. And we find in a lot of places, it's non-profit organizations, it's civil society that feeds more people than the government, although the government claims to feed people. In states in India like Kerala, Telangana, 100% of people who were fed, migrant laborers, daily wage laborers who were fed by non-profits. In states like Gujarat and Andhra Pradesh, it was over 90%. Here's a map, for example, of a non-profit in Mumbai, which is doing yeoman's work in making sure that people don't go hungry in these times. They have a detailed map showing, exactly where, how many food kits are going out on a daily basis. I show this because I was once, closely associated with Praja Foundation, and so they're close to my heart. And the last, and this is very important because in times of emergencies, governments take on more power. So it's very important for us to check government excess. Emergency powers taken on by government taking on powers that, tell the press what to write and what not to write. These are freedoms of the people. And as Calixto says, there was the Sophie's choice. We shouldn't be having the Sophie's choice between liberty and, health. We should have both. So free trade and globalization are actually good for health. It helps when countries trade, when one country, for example, may have an excess of masks and may trade with other countries who want masks. So free trade and globalizations are good for health. Authoritarian, centralized decision-making is actually not. Because when you centralize the decision-making, going by Hayek's famous knowledge problem, you end up with the same problems. You would not know what is required at the ground level. And it's impossible for one central planner to know what's required at the ground level. This is something that we've known for decades now, thanks to F.A. Hayek's famous Use of Knowledge in Society article. The next is police brutality. We've seen that in countries across Asia and maybe outside Asia as well, where, to enforce the lockdown, there are beatings of people, even healthcare workers. So this is something that needs to be curbed. Police brutality is becoming a major problem and must be curbed wherever it occurs. And finally, governments like to acquire power during emergencies, but not give it up afterwards. So these are some pictures of police brutality, and the picture of the president of the Philippines saying, well, shoot them. Shoot them dead, actually. So we've got to make sure that we hold the government in check, that we don't lose our liberties in this time of pandemic. Thank you so much for listening to me, and I hope I've given you some thoughts to think about.
Thank you, Azad, for very succinctly laying out some key areas where we can be thinking about and where the civil society and the free market can provide important solutions to this global problem. We're going to take now some time to further this conversation, but one of the benefits of technology in a large, big room where we normally would in just a few minutes, in approximately about 20 minutes, we will actually begin the next session that we will have. And so in the in-between, feel free to go to the Discord community, but we will be starting our Shark Tank competition. This year, it's very unique. You actually get to be a judge. So we're excited to make you a part of the judging panel this year. And we'll get into more of that session of how you can participate and be a judge. We've got some great pitches, some great projects that maybe can give you inspiration in terms of what you'd like to do in your country. But we look forward to seeing those pitches and to having you participate for the very first time in the Shark Tank competition as our fifth judge, so to speak. And so with that, thank you everyone for joining us tonight. We look forward to seeing you shortly for the Think Tank Shark Tank competition for the Asia Regional Liberty Forum. See you soon.